TEDxWorthington Women's Stage. Callie, you're a breast surgical oncologist at Mount Carmel. By the time patients get to you, they've obviously been through a lot. What made you want to do this talk?
So if you look around the room, 1 in 8 women will be diagnosed with breast cancer during their lifetime. So if you imagine this theater completely full, more than the front row is going to have a diagnosis of breast cancer. And despite that fact of how common it is, people come into my office for well checks, for a cancer diagnosis, my family, my friends, and they talk to me about things that are wildly wrong. And so I think it's important to demystify your breast health and breast cancer facts.
Let's do it.
Okay.
A lot of women in the room assume that if nobody in their family has ever had breast cancer, they have less risk. Does family history actually mean less risk?
So family history is a very important contributor to your overall risk. But what I will tell you is that 90% of breast cancers in the United States do not come from a genetic mutation. They just happen. So if you don't have a family history, that doesn't mean you're not in the clear. You're still in that 1 in 8 risk.
Speaking of family history and our mothers and grandmothers, I think that I've heard it before, probably from my grandmother, that when you turn 75, you no longer need mammograms. Is that true?
That is not true. So what I will tell you is the data shows that 20% of all new breast cancers come from that population of 75 and above. And more importantly, 40% of all breast cancer mortalities also come from that population group. That's pretty significant. What I tell people is it's an individualized decision between you and your doctor. So if you're 75 and you have a reasonable life expectancy, imagine 5 to 10 more years, and you'd want to know if something was going on in your breast, you definitely should go get your mammogram.
Now, on the flip side of that equation, though, a lot of younger women, when they go in for a mammogram or even before they go in, are told that they have very dense breast tissue. What does that actually mean, and is that something that we should worry about?
So dense breast tissue is extremely common. About 50% of us have that. And there's nothing wrong with you. It's just the way that you're made. There's also nothing you're going to do to fix that. As we get older, our breast tissue does become less dense, but some of us will just have it for our whole lives. It does increase your risk of developing breast cancer in the future by about 2-fold. But in terms of all risk factors, it's a drop in the bucket. The most important thing to know is that you have it so that you can deal with it. Because a mammogram alone is not a sufficient test. If you've ever gotten a mammogram and gotten that letter in the mail that says that you're dense, it recommends that we do additional testing, often an ultrasound or an MRI, so that we can truly look through that dense tissue and make sure nothing's hiding in there. But the most important fact is that you can't just get those tests on your own. You can't call a mammogram center and get that done. You have to advocate for yourself and get a doctor's order.
So speaking of other risks, I've had friends believe this, and I'm sure maybe there's a few people out here that also believe this. Some women avoid mammograms entirely because they're concerned that the radiation they get from the mammogram will give them cancer. Is that a valid concern?
It is not. Cold bit. So mammograms have an extremely small amount of radiation, and you're only getting it once a year. Also, you get exposed to radiation every single day. There's radioactive isotopes in the water we drink, in the food we eat, like bananas. If you go on an airplane, you're getting doses of radiation because you're flying closer to the sun. And every single one of us walked through a radiation field today to get here because we went outside and we were exposed to sunlight. Mammograms do not cause cancer, they save lives.
Did everyone hear that? You get more radiation from eating a banana, so you have no reason not to get your mammograms. Anyway, as a mother, I've heard breastfeeding decreases your risk of breast cancer. Is there actually truth to that?
100%. So breastfeeding decreases your lifelong risk of developing breast cancer. And what I tell women is it doesn't matter if you weren't good at it, you tried. It doesn't matter how you do it. So if you were lucky enough to be someone that could truly breastfeed in a natural way, that's great. But if you're someone like me who had to pump, or if you had to exclusively pump for health reasons, you still get that same benefit.
I feel like I should have brought a pen up here just so I could write down all my follow-up questions. But now that we're talking about the power of motherhood and what that can do for our bodies now and in the future, let's talk about younger women. Younger women, we're seeing more and more younger women being diagnosed with breast cancer. And obviously, the question becomes fertility. So, what does breast cancer do for fertility? Can you get pregnant after breast cancer?
You can actually. Now, what I will tell you is that some of the treatments can obviously decrease your fertility, especially things like chemotherapy. But there actually are trials that have been done where for women that are taking, let's say, just estrogen blockers, they can safely stop that therapy for a short period of time, essentially long enough to get pregnant and have a healthy baby, and then restart that medication with really no change in their overall survival, which is truly incredible for the 30, 40-year-old woman that walks in my door.
I love that. What like a beautiful place of hope to end on.
Mhm.
Callie, if every woman in the room remembers one thing from this talk and takes one thing out of this room going forward, what would you want that to be?
So today we're hearing speakers that are telling us how to take better care of our communities, of our families, of ourselves. And I want you to know that your breast health should be front and center when you're doing that. I want you to be doing your breast exams, getting your mammograms, because it truly can save your life.
As women, we are all managing so much all the time. We have a doctor's appointment we cancel because we don't have childcare, whatever it may be. But today we're asking you to stop doing that because you do need to take care of yourself. And at TEDxWorthington Women, we want to help you with that. So out in the lobby, Mount Carmel Health Systems, where Callie practices, has a booth out there, and they're able to schedule you a mammogram today or connect you with a primary caregiver, whatever services you may need, whatever kind of care you need, they're willing to help connect you all today. So we hope that you'll stop out there and take advantage of them. Callie, thank you so much.
Thank you for having me.